Hi, my name is Nguyen-Huu. I've been working on drug discovery in BioAge Labs for the last 6 years, and I found it very fascinating. Really happy to talk about that. And by the way, in Zuzalu, there's also saunas and two gyms, actually two saunas, two gyms. We also do cold plunge in the morning. There's so many ways how you can actually implement more healthier habits in your lifestyle. Highly recommend it. All right. The main goal of this talk is basically to talk about the drug discovery process, and I really hope that by the end of the talk you will understand why it's so complex and why it takes so much time to develop a drug. On average, it takes between 7 to 15 years, and 7, it's like you're pretty lucky if you can do it in such a short period of time. And it also costs a lot of money. So I found this picture online. I think it's pretty cool, describing all the steps of the process. I disagree with some numbers. I think phase 3 trials usually are much more expensive. But overall, it describes the process. And I'm not going to do a review right now. I'm just going to dive in each step. So first of all, let's start with target identification. So what does it mean? 95% of the drugs on the market, they're actually targeting proteins. And usually you need to find a protein of the one that you think will be a good target. And this is a very difficult process. A lot of people working on it, a lot of tools, not enough, but there's some already done and designed and built in order to make it easier, and there are so many more opportunities to improve this process. So first of all, I want to show you open targets. So this is the platform that basically collects a bunch of data that is out there in PubMed, public data, various data sets, and it gives you an overview of how relevant each protein to the disease, and what associations are out there with different diseases, what type of associations were found there, are there drugs already on the market for this target, what pathways it's participating, animal models, and so on. And why is it cool is like there are 20,000 proteins approximately in our body. And when you select a target for your drug, you really need to understand there's so many criteria that it should pass in order to be a good target. And you basically in a giant forest, right? And you need to understand, is this target good or not? And you try to use as many resources as you can to understand if it's a good target or not. So platforms like Open Targets are extremely valuable, and I will show a couple more. I think Cat asked, hey, when you're going to give a talk, please also tell how people can be involved into the process. And if you really want to help longevity and drug discovery process in general, and you have a technical background, that would be a great way to start. To participate in a platform like this, Open Targets, Pharos, Open Genes, and be part of their teams. They also have open sources. They also have, some of them are open source, so they can also join their teams very, very easily. So if you look at the open targets, here is overall score. There's genetic association. And there are many studies show if you have a genetic association of your target with the disease, the likelihood of approval and taking this target to the market is actually much higher. For instance, there is drugs. You can sort by the drugs and you see, okay, for this target, there's no drugs on the market. Maybe it's a good idea to develop a drug for this target. That means you're not going to have competition. And that means there is a lot of unmet need as well. You can also see the pathways. You can see the text mining, meaning how many publications support this target. And you can see, for instance, here, ApoE is quite known drug that's associated with Alzheimer's disease. Another platform is Pharos. I really like it. It's very well done. Basically, it shows the description of the protein, and there is a lot of different data that you can see about the target. There's also this pretty cool level summary of the protein, basically saying how well developed this protein this target is. And they come up with the structure T-dark, T-bio, T-chem, T-clean, meaning, oh, we don't know that much information about this target yet. That means it's basically the fundamental biology is not there, and probably it's not a good idea to develop a drug for this target if it's in T-dark, because not enough data out there, only if you're ready to invest many years and money to explore this deeper. If you're in the T-bio stage, that means that there's probably enough biology to take it further. If you're in T-chem stage, that means there's already compounds that binds to this target, and that means that you can already test it on animals. And T-clean means that you already have drugs in the market. So this is the ACE target, very well-known target. There's a lot of drugs for it. And that's why you see it here, T-clean. They also show the expression data, meaning at what tissues this target is expressed. And usually the good drug targets are the ones that don't express in many tissues, otherwise you're going to have a lot of side effects. So it's very useful information, check it out here. There's also a lot of data on the protein sequence, protein structure, and all the compounds that binds to these drugs. Another target identification platform was built by Anastasia. Anastasia, lift your hand. You can come and chat with her, but they basically building opengenes.com, and they try to identify drugs that associated specifically with longevity and help people to search through those targets. Great. There are a couple companies who are working on the target identification process. One of them is in Silico, quite a well-known company. They got a lot of funding, and they launching quite a few drugs in the clinic right now. They're testing them on human. They have platform Panda-Omics. Unfortunately, you cannot just look at it because you have to pay for this. But I know that quite a few big pharma companies and biotech companies already they're users.
Sure.
And they're using AI and machine learning approach in order to not only collect the data, but also analyze holistically omics data, trying to identify better targets. And I will say a couple words about BioAge because we have our own platform as well, and we have a little bit different approach. Our approach is that we, first of all, we base all our research on the human data, and we work with longitudinal cohorts. What does that mean? That means that you have people who sign up to participate in studies up to almost 50 years ago. So 50 years ago, there are a few thousand people that decided to participate in studies. And they were coming every few years and went through different exams, checked their health, and they also got their blood samples collected. And over this 50 years, we collected all the medical records. So we know all the disease that they got, we know other medical history, different blood samples, MRIs, and so on. We know also when they died, because it was a study that started for people in their 50s, right? Probably almost all of them died right now. And we have 3 cohorts like this. So why is it cool? Because we have the data that were taken 20, 30, 40 years ago, and their blood samples were stored in a freezer. So we took those blood samples, and right now, because there are so many cool technologies right now available, we are able to identify proteins, blood circulating proteins. And current technologies allows you to identify up to 7,000 proteins in your blood. So we took those proteins, and we looked at their levels, and we also look at the correlation with different outcomes, such as mortality or different chronic diseases. So you have your proteins levels, you have your outcomes, and you basically check at the correlation. Okay, if this protein is very high, that means your likelihood of living longer is higher, or if this protein is too low, your likelihood of living longer is shorter. And this way you would be able to identify proteins, meaning drug targets, that can potentially affect your lifespan. So this is our approach, how we're doing it, and of course we're backing up with bazillions of other data that we also see on the open targets forums and other platforms, and also among other data sets. Okay, so you are here, right? You're identifying your target. So as soon as you find the protein that you think is relevant, and usually data team works on this, and after this biologists come and they do a bunch of reviews and they read a bunch of papers and they say like, yeah, that's the one. Looks like it's checking all your boxes. After this, you do the target validation, meaning that you take
like
cell or animal model and see if your target is actually decreasing, or like if you drug your target and you actually it affects the pathology, right? For instance, if you decide to develop a drug to targeting like diabetes or cardiovascular disease, you take animal who has the disease, and you treat your model with the drug, or you overexpress or downregulate the gene that you select, and after this you see what's the effect of the did you actually decrease the symptoms or not, right? Were you able to treat the disease or not? So, and you basically validate it on animals and on cells, and as soon as you select the drug, and usually it takes a while, it takes like 1 or 2 years to go through all this process. And the next step will be target to lead. So you know that, okay, I have a protein, I have a drug, and now I need to develop a drug for that. I have a target, I have a protein, but now I need to develop a drug for that. How would you do this? So Nathan already talked about that there is quite a few different approaches how you can develop a drug, and some of them are small molecules, some of them biologic, that much bigger molecules, proteins, and there's also gene therapies and so on. So I'm going to talk about how you're developing small molecules. So one of the classic approach is that you take 96 or much larger well plate, and basically you pour different compounds. You usually have libraries that has hundreds of thousands of different compounds, and it's usually like a robotic approach, right? There's like some robot that pours in all this like small tiny wells. It pours different in each well different compound, and it looks at the outcome. So when you do this, there are quite a few assumptions that you make. First of all, you decide what dose you pour your drug at, and sometimes it can be too low, sometimes it can be too big, so you easily can miss some promising drugs that actually tackle and attach to your protein. And another assumption that you do is that you assume, for instance, you wait for an hour or two at 24 hours. So you making assumptions of what duration you want to expose your target to the drug. So I would say that's the limitations of this approach. And another limitation that's actually, you usually can screen a couple hundreds of compounds like this. It's been working so far, a lot of drugs been discovered this way, but I think right now there are quite a few more modern approaches that yields much better results. So another approach is basically AI-based drug design, and here this is very cool GIF that I found on AtomWise, and there are quite a few companies who are doing this, but AtomWise are one of them. They have AtomNet platform, and they use deep learning algorithms to predict how well your various molecules interact with your protein of interest. So they basically can mimic atomic structure of the protein and these molecules, and they see how well they're touching and where they're touching to it. And this is like in silico approach of how you can design the drug. And another approach, I really like this one, I think it's a brilliant engineering and chemistry behind it. It's called Del screening. So first of all, there's quite exciting chemistry how they're generating those libraries. So I actually cannot tell you all the details, but at the end, after they're generating the libraries, they got chemical compounds and unique DNA barcodes attached to each compound. And it can be done at a massive scale. And as a result, after generating a library, you have 1 billion of molecules. And each of them is unique, and each of them has unique barcode attached to it. Why it's important? After this, you take your target, you take your protein, and you immobilize it, so you attach it. And you just pour all these billions of compounds on your target. And after you do it and wash away the ligands that didn't bind to your protein, only the one that has like the highest affinity have left. And you have a barcode that you basically can sequence and understand what actually molecule attached to your target. I think it's quite a brilliant approach. It's quite fast to do it. It's expensive, but at the same time, it gives you the best drugs out there. And quite a few already programs launched into clinic using this approach. All right, so over here, there's definitely more approaches of how people developing the drugs itself. I just mentioned you a few. But after this, after we found the compounds that binds to your target, you have to select the lead candidate. So you're basically taking all these molecules, you run a bunch of experiments in them, and you select the best one. So when you have few lead candidates, basically the molecules that you the most interested in, and they showing great results, you have to do a lot of studies. You have to do, first of all, you have to do in vitro studies on your cells, try to understand what the mechanism of action, what's the target engagement. You also need to do the efficacy disease models that I mentioned before, when you basically take an animal and after assess what's the therapeutic effect. And sometimes it's very easy to do. For instance, mice are the most popular animal models. They're very easy if you wanted to study cancer, for instance, because that's how they usually die. But it's quite challenging to study Alzheimer because it's not a good model to study Alzheimer. So, and that's maybe one of the reasons why we still don't have good drugs for Alzheimer. So the availability of animal models is a quite big problem. After this, you also need to study various toxicology, meaning what's the adverse effects on different organ systems. And you also do it in different fashions. You try to push as much as you can, basically doing single dose as big as that you can until basically you push the brakes, right? And you also want to expose it chronically on a long term and see what the side effects will be. In this case, you also do safety pharmacology studies, basically looking at the cardiovascular, respiratory, central nervous system outcomes. You also look at the developmental issues that possibly your drug could cause. You also look at the reproductive system, how your drug affects that. Another thing that you really need to look at is also drug metabolism and pharmacokinetics, meaning how bioavailable your drug when it gets in the human body, how fast it gets cleared by your body. And you also look at the potential drug and drug interactions. And of course, besides that, you also need to look at the drug formulation and stability studies. So basically, when your drug is in the box, how stable it is, right? And people literally, they take in drugs, they put them on the shelf, and they check every month or two or a few years, seeing how stable your drug is. So that also takes a while. And you also, of course, need to understand what the dose is supposed to be, how frequently the drug is supposed to be given, and what the dose window that is safe for people. And after this, after we did all of this preclinical development, which also takes a few years, you got to clinical trials. And different phases of clinical trials, they aim to check different things. First of all, we start with phase 1. So this is basically first time in human, and you don't want to give it to way too many people because sometimes, unfortunately, people die in clinical trials, and this usually happens in the phase 1 because the molecule that you develop, it was never tested on humans, it was only tested on animals, and animals are not people. Obviously, we don't know exactly how the drug gonna be interacted in human, and you basically usually put In phase one, it's just like a few dozens of people. So we recently won phase one, and it was 21 people. You basically wanted to have large enough number to understand, yes, it's actually safe, but not too large number, not to basically expose too many people to your drug. So what do you check in the first phase one? Safety, of course. You also check how it affects your body and what the safest doses. You usually run multiple doses in the phase one. So after you move to phase two, and the rule of thumb, every time when you move to the next dose, to the next phase, you add the 0 at the end. So you had a couple dozens of people here you have a couple hundreds of people in the phase two. In phase three, you have a couple thousands of people. And you also add a 0 to the price, to the cost of the study. Here it's usually like a million or two. Here's like tens of millions, and here's like hundreds of millions. So in phase two, you check efficacy. Does your drug actually work? Does it actually treat the disease? Do you actually, that does actually help, right? In phase three, you basically confirm your results that you get in phase two, and you usually get a much broader population to study the drug. And interestingly enough, there's actually phase four. And phase four is usually you follow the people who were prescribed your drug, who are taking your drug, and you collect the data from hospitals, you work with the doctors and checking like on long-term effects, right? How your drug is actually affecting people on the longer term. And sometimes drugs got withdrawn because they were on the market for a few years, and they got withdrawn because we actually found, oh, okay, there was actually side effects that were not good, and we were not able to identify them in phase one or phase two or phase three. But later we saw this actually like long-term side effects, and drugs got withdrawn from the market. So how likely it is to be approved? So if your drug already got to phase one, there's only about 10% chance that's going to be approved and will get to the market. It's a very, very low number. And it's a bit higher for infectious diseases, and it's a bit lower for oncology, but overall, only one drug out of each 10 drugs that got into the phase one got approved. So what's the reason? Why drugs fail? So first of all, it's clinical efficacy. It just doesn't work. So you check it on an animal, but it actually doesn't work on people the same way as it works on animals. There's a lot of mice treated and survive because of the drugs, but unfortunately, not that many people. The second reason, it actually has toxicity and side effects. So you studied that the drug worked for some specific thing, but you actually didn't know that it's actually maybe it got attached to another protein, right? And has another side effect. Poor pharmacokinetics properties. So basically, your drug wasn't absorbed or excreted from the body properly. And the 10% why the drugs don't get to the market, because it was poor business decision. So lack of commercial interest or poor strategic planning. And very frequently, it's actually while you were doing your clinical trials, there was another drug that competing with you that just like much better, right? And when you got to the market phase, even though your drug worked, your drug is not relevant anymore because there's a better molecule already. So if you look at the FDA approval rates, approximately currently there's 50 drugs make it per year to be approved. It's not that many, it's only 50 drugs. And that would be great if we can make this number higher.
What happened in 2016?
What happened in 2016? Poor choices made by people.
Okay.
So, question, can we make it cheaper and faster? So I think we can improve a lot over here, right? We can, biology is very complex. There's a lot of data goes into it, but basically if we improve the target selection process, there will be already huge improvement overall down the line. And if you would learn how to make it better, we definitely can affect this 10% and make it higher. But there's a lot of things that we can improve on the way. We can improve how fast we design the molecule, and then really quite a few achievements are done. And this way, we can also improve finding better animal models, which is much harder. And we can also improve how we run clinical trials. So we talked a lot about network states here. Also today we have interesting conversation during breakfast with Mikey, who's trying to run decentralized voluntary clinical studies. There's a lot of things can be done. There's definitely not enough people who work on this. There's definitely not enough engineers who work on this. And there's definitely not enough progress. A lot of things are still done quite old school. So if you're passionate about longevity, I would highly recommend you to join the movement and develop better therapies. And another way how we can make it cheaper and faster, there's quite a few models, right? So right now I describe you the process. You start from the very beginning and you go to the very end. But you actually can fast forward the process. One of the business model how you can develop the drugs, you can in-license drugs. What does it mean? That means you can go and look at the drugs that passed phase 1, phase 2, and sometimes in phase 3, but didn't make it to the market. Why they didn't make it to the market? So there are quite a few reasons why they could not make it to the market. First of all, it could be didn't show efficacy, meaning, okay, I know that it's targeting this gene, right, and it's actually get attached to this gene. But unfortunately for the disease that I selected, it didn't show any efficacy results. And after this, very frequently people just put it on the shelf. Okay, this is drug, this is the molecule, it binds to this target, but didn't show the efficacy. But if you know that this target participates in another disease and you have enough evidence, you can actually go to these people, buy their drug, and start these clinical trials for your indication. And this way, you save quite a few years, up to 5-6 years of the development process. We in BioAge Labs actually did this and have pretty good results. And it's actually very common approach to drug development. There are quite a few drugs that are sitting on the shelf, the one that already proved their safety in the clinical trials. Another reason why drugs can be sitting on the shelf is because, especially with big pharma, sometimes they just close the whole direction. They decided, like, okay, we're actually not interested in cardiovascular disease anymore. We found that the market is not the state that is interesting for us. We decided that we're gonna put all our focus on the cancer. And they have their own reasons. Maybe they have very strong research in cancer. Maybe they don't have enough money, or maybe some other reasons. So there are a lot of business decisions that are done by pharma companies and biotech companies, and they just completely moving their basically gears to another direction. And they're just putting all those drugs on the shelves, even though they spend a lot of time and money in developing the molecules. So, and this is basically called drug repurposing. So you can take all of those drugs, and there's databases of those drugs. You can take those drugs and you can repurpose them and run another clinical trials for your indications. And this way you can save quite a lot of time and money. And that's it for me. Thank you so much for your attention.
It's good to see so many familiar faces. Today we're going to talk about something exciting. It's reprogramming. We're familiar with the concept of reprogramming within the context of computers, right? There's a lot of actual programmers here at Zuzalu, and the idea of programming something is extremely powerful. The idea that you can take some set of code, some blocks, and put them together into something that is meaningful, that has a user interface and a user experience is extremely powerful. So we're going to talk about how we can achieve this from a biological perspective in the cell to achieve something equally powerful, but for a rejuvenation application, for longevity applications, for health plan applications, we're going to go from 0 to 1 together. And I will go ahead and start with an observation of why the community at large is doing this. Well, we realize that this is a very powerful technology that can have a big effect. Why? Because people are living longer, but not necessarily healthier. and the current structures are incremental, they're not exponential. So if we are able to actually code ourselves into health, why not, right? So we're still very early in the phase of the entire field of epigenetic reprogramming, but we are starting to see some applications that are very promising, and we'll talk about them. In the context of living longer and rejuvenating, there's something that we all understand, which is the miracle of life. But aside from the fact that a new life is born, something really interesting happens, which is two aged adults, maybe they're both 30, have an offspring that is not 30 years old. It resets the entire age group. So if you take two 30-year-old computers and put the parts together, you don't get a brand new Mac or a brand new PC. You get an older piece, an older device. So it adds to the miracle. Why is it that we can essentially reset and rejuvenate life within that context? And could we take whatever those processes are and apply them to us as adults? Well, we have been able to see the different protocols, and we're going to talk about the different protocols that ultimately achieve that. And we'll talk about different kinds of applications, but the long story is there are different programming factors that we can utilize to put together a cocktail, give it to a somatic cell, an age somatic cell, like an adult skin cell, and we can make it go to a younger state, or even so far past a youthful level that it forgets that it's a skin cell, but now it's a pluripotent or embryonic cell. They can do anything. It's almost like going from being 80 years old to being maybe a 10-year-old or a one-day-old, right? So there are benefits to both. And reprogramming at a glance is actually an award-winning technology. Dr. Shinya Yamanaka won a Nobel Prize for this. And really, at a glance, it ultimately works on a spectrum. It goes back linearly, where a somatic cell or an adult cell, when given this rejuvenation cocktail, right, this reprogramming factors, goes back in time through a journey that is rather important.
I see.
It goes through a safe area called the area of return. So it rejuvenates, and if we stop the reprogramming, the cell would continue to age and continue to remember that it's, in the case of a skin cell, it knows how to perform the duties of a skin cell. It creates collagen, it creates elastin, it creates all the things that your skin needs. But if we allow it to keep getting reprogrammed, it goes into an area called Area 51. Why do you think it's called that way? Well, it's not a very desirable area, because if it stopped getting reprogrammed then you start seeing mutated types of cells, the cells that you wouldn't want inside your body. So it's a very powerful technology, and with power comes great responsibility. So control is extremely important for this kind of reprogramming. And if we allow that cell to be reprogrammed all the way to the back, that cell becomes a pluripotent cell. And it's been used for many applications. So some companies are taking cells, making them embryonic or pluripotent, and then de-differentiating them. So they're taking skin cell or differentiating them back. So they take a skin cell, bring that back to pluripotency, and then they make it a muscle cell or an eye cell or something else that they potentially want to use. The question is, if we are able to rejuvenate all the way back to an embryonic state, could we just rejuvenate a tiny little bit and see rejuvenative effects? In other words, could we decouple the de-differentiation stage with the rejuvenation stage? And that's what all these epigenetic reprogramming companies are trying to do. And at the end of the day, we're doing this thanks to the fact that we are ultimately code We're not zeros and ones, we're ACTGs, and we can play with this. And for those that want to understand a little bit more about how this interaction happens, well, I like to think of a cassette. I know it's been a long time since we've used these, but you'd be walking around with your Walkman, listening to your jam, and all of a sudden you hear static. What happened was the film is no longer being read properly by the device. And in a way, all you had to do is try to figure out how to rewind it and make that film readable again. In a way, the cell ultimately is a complex machine that reads code. That's what it does. And it has different regions, it's got different processes that take your DNA. Sometimes it splits them, sometimes it copies them. It does a bunch of things. And the cell knows, depending on its job, like a skin cell, that it's only going to focus on the area that pertains to your skin. And it's going to perform those activities. It's not going to start, ideally, developing bones inside your skin. The cell is wise in a way, and the cell is a very complex machinery. But every now and then, it has issues with reading, just like that cassette. So you have different processes that are an issue, like histone loss, DNA methylation changes. We have chromatin remodeling, different kind of focal heterochromatin issues. Ultimately, it's like your film is not being read optimally, and that beautiful song that you are is not being played at the right tune in the right way. And of course, you experience slowly what we call aging at different stages. So what a lot of companies are doing is they're using either mRNAs, they encapsulate them in lipid nanoparticles, which is little fat bubbles that are food for the cell, and the cell takes that in and starts reprogramming itself with that cocktail that you give it. Other companies are using AAVs, which are viral vectors, that ultimately they're encapsulated in a capsid. It goes into the cell and attaches itself to the nucleus and starts giving the cell certain kinds of factors and instructions. The biggest thing is, despite whatever technology we decide to use, the biggest thing is control. Because if you remember, that whole journey that the cell takes on can be a dangerous journey. So one of the biggest things that people are concerned about with this very powerful technology is, what if we start creating teratomas and cancers? So we need to be very careful, not just in industry, but in academia, so that we can communicate the safety component of whatever reprogramming cocktail there is. Now, we're talking about the context of rejuvenation here, but there's a future in which we can start reprogramming ourselves in very other different ways, exciting ways. So it's really important that we communicate, that we can control this process in a very powerful way, much like, if you want to heat up a really delicious meal, you're not going to use the power of the sun to heat it up. You immediately incinerate it. You have to be very careful with it. And of course, let's back a little bit. I was asked to talk about the Yamanaka factors, because the Yamanaka factors were a Nobel Prize winning breakthrough. So Dr. Yamanaka figured out that OCT4, SOX2, and CMYC, and KLF4 are able to, when put together in a different precise pattern, they're able to open up the cell into a reprogramming state. So we like to compare this as if you take the cell to the spa and the cell relaxes. And I apologize for the scientists out there if I'm being extremely simplistic in my approach. Then again, I am not a scientist. I'm just a business guy who fell in love with this technology. And this is how I usually can conceptualize what's going on. And scientists are still trying to figure out what happens at every single stage, but you're giving the cell certain set of instructions, like go to sleep early, hydrate, exercise, relax, get a massage, whatever it is, and at the end of it, the cell is rejuvenated. it's actually the cell goes into a relaxed state. And the longer that relaxed state, the cell, it's so relaxed that it forgets to be a skin cell and eventually ends up being an embryonic cell. So it's like an annealing process, a process where the cell is able to kind of structurally shake off a lot of those issues that it has accumulated throughout time that affect the way it reads that film. So it has to be structural because, again, remember, the cell reads the film, and that whole process is a very physical, structural process. So I like to divide it in two, the Yamanaka factors, OCT4 and SOX2, and they work together. So OCT4 is really, it encodes for, it encodes a DNA binding transcription factor. It's a master regulator of epigenetic reprogramming. In fact, if you were to just give OCT4 for really long periods of time, you eventually would induce reprogramming and pluripotency, especially if there are factors that are endogenously expressed in a certain type of cell, not in all cells, in some cells. Then SOX2, it's a little bit like an essential gene that allows the cell to stay alive and not die during this process of rejuvenation. I like to think of them as two friends that are opening up the doors for rejuvenation. They work together. And then here comes the rejuvenating team, right? And they're believed to really drive the first wave of transcriptional activation, which is KLF4 and c-Myc. Now, some people are afraid of c-Myc because they say it's an oncogenic. But then again, if you go to the beach, you can enjoy it without getting cancer. That's how I like to explain this. We can use and harness the power of c-Myc for good, for rejuvenation and reprogramming factors, without expressing it for so long that it starts creating cancer. Again, control is very important. But beyond the Yamanaka factors, there are other factors that are very important. For example, what are usually called the Thompson factors, Lin28 and NANOG, sometimes work together to even replace OCT4 and KLF4 and c-Myc. Some companies are actually adding these two, like Turn Bio, they're adding these two factors into the cocktail with the Yamanaka factors to enhance the controlling ability of the reprogramming. Because at the end of the day, you want to reprogram it as fast as possible and get there as soon as possible, it seems like. Because the quicker you are, the less of a chance there is of cancer and tumors forming. Some other companies like David Sinclair's Iduna and LifeBio, what they've done is just taken c-Myc out of the equation, and they reprogram with 3 factors. But I want to think of a world that is not so revolved around just the Yamanaka factors and the Thompson factors and all these other factors, because at the end of the day, we have about 20,000 coding factors, and those are just 2% of the genome. The other, more or less, around 98% of the genome does not encode. So it works for regulatory, like creating scaffolding and different things. And also some are non-encoding, they're DNA, RNA, of which sometimes we don't know what functions they have. So again, it's exciting, but this is why you're seeing a lot of reprogramming companies get funded in the billions of dollars, because they are trying to get into a landscape that has a huge discovery potential, of course, for us all, a huge beneficial potential. And why are we doing this? Well, because ultimately we know that there's a huge economic incentive in helping people stay younger for longer. And I like to say we live in a world in which cocktail 1.0 has already been developed, is Yamanaka's factors. Then we're working on 2.0 right now, but fast forward 10 years from now, we could be working with cocktails for all sorts of things. So for those who are new to the field and trying to understand how do we benefit the field, how do we get into this exciting realm of rejuvenation and such, I want you to think of something that is actually humbling and sobering, which is naked mRNA. It's not going to do anything for you unless you deliver it properly. So you can have all the rejuvenation cocktails you want, but if we don't get it into your cells properly, if we don't get it into your cells in a safe way, in a controlled way, in a way that is ultimately going to help you by creating those proteins that you need to rejuvenate, we're not going to get there as a society. So I would like to invite everyone to take a step back and say, okay, let's go and figure out how to get all these cocktails, but at the same time, let's focus on the infrastructure to create the next generation of therapies, mRNA-based therapy, AAV therapies that are non-toxic, and toxic loads are a big thing in this field, right? The FDA, it's okay with certain toxicity, but could we do better? Could we try to come up with much better pathways and processes and platforms that allow us to give these interventions to people? And I think we can. So where are we in the industry today with the application of this cocktail, this powerful cocktail in the industry? Well, we're seeing skin applications, immunology applications. So you're thinking of, and I'll have a slide about all the companies that are doing things. We have eye and muscle as well. But just at Turn Bio, for example, they have data, human data, in 40 different types of human cells. So it's really interesting. And when I say human data, I mean human cells, not in vivo data. So companies that are working on this new paradigm, as of last year, thanks to Ada for putting this together, are here on the screen. So I said Iduna is working in the eye. They actually just recently deployed a paper that suggests that their therapy can actually enhance rejuvenation in the eye. I think 35%, that's what they were seeing rejuvenation in. Youth Bio is also focused on different kinds of applications. Shift Biosciences and New Limit, they're working on the cocktail finding. Altos, it's a big institute with a lot of really cool names, a lot of good people there. They're trying to figure something out, and they've raised a lot of money. So they're still discovering how to use this and implement this data. So you can already start seeing all the big numbers coming into the field, and everybody is going to have an opportunity to change the world. A lot of people are concerned about the competition, but competition is good for the field. I think the patient ultimately wins. And we hear of a couple of new ones like Rejuvenate Bio, and they also made the news about 2 months ago with a paper, and then Marble Therapeutics. And I would like to now show you, so I'm running out of time, this is the last slide, a really cool video. If we can switch over to the video, 'cause I think Google didn't like the initial video. So we're going to switch over the keynote. This is the cocktail, the 6-factor cocktail as applied to immunology. So on the left, you find the control, which is T cells with an already existing cancer treatment, fighting the green stuff. The green stuff is cancer, the white stuff is T cells. And the way scientists make these experiments, they're called engagements. It's almost like it's a death match, right? You put the T cells and the cancer cells in a very sophisticated way, and you just have it go at each other. And you do it as many rounds as possible. And of course, if you're a human, you want your T cells to win every single round. However, that doesn't happen. There's something called cell exhaustion, that even if you have the best CAR T therapy in the world, you're going to face. By round number 4, your T cells are unfortunately succumbing to a very aggressive cancer. That's not a good thing. When we treat the T cells with the rejuvenation cocktail, with the reprogramming cocktail, we're treating a population that
I don't but
now has been tasked with the task of fighting the bad actor, the cancer, but now has been given the tools to be a rejuvenated army.
the guy.
And by round number 4, not only do they kill the cancer completely, and you can see this little green dot just being obliterated, but they start proliferating even more. So not only do they kill better, but they reproduce better. By the end of it all, you don't just have no cancer or less cancer, but you have an army that is now bigger and ready for the next engagement. And we're seeing this even after round 6.
Right, and a judge. What?
Now the question is, what else can we apply this in? And we're very excited to say that we have data in skin as well. We're not just doing it so that we can all look prettier and better. The skin is a very important organ, the largest organ that we have. It'll protect us better against cancer and other environmental issues that we have. So I thank you for the opportunity, and this is very exciting to get behind. And if you want to talk about it a little later, feel free to email me, sergio.ruiz@turn.bio.
Bam, dude. You still over?